Well, allergies are something where a lot of us are dealing with, especially this time of year. Here to talk to us more about allergies today, Cecile Robes, a doctor of osteopathic medicine with the Coastal Family Medicine group here. So allergies, obviously, I have to do is walk outside right now, and you see the cars are littered with the yellow pollen. But interestingly, you were telling me during the commercial break, that's not really the pollen that's going to affect us the most.
So usually large particulate matter is not typically what we react against. It's usually the smaller things, fungi, mold, dust, mites, unfortunately bugs and the emanations from bugs that we typically react against.
Awesome.
Yes.
That made me laugh. Yeah, I'm an idiot. As far as the pollen that we see now, though, because it is so large, we were saying that when we get the first rain, we're going to see a yellow streak going down the road. You're talking about that being bigger. Are there smaller things associated with that when people do get this time of year, it is really, this starts to be the onset?
Absolutely. There's smaller pollens that tend to affect people and start up that whole cascade, that trigger of the runny nose, the congestion, itchy, watery eyes, and oftentimes, again, very small particles. And it's not sometimes the first exposure, sometimes it's the second or 100th exposure that will trigger that allergy cascade.
I know over-the-counter medication seems to be the thing that most people gravitate towards. Again, we were talking about injections are also available. How severe do your symptoms have to be before you're going down the road of having an injection maybe once a week, once a month?
Usually you need to fail kind of all the over-the-counter stuff, all the prescription medication. So nasal corticosteroids, the best choice for persistent allergies. Then you can use oral antihistamines. You can also use intranasal antihistamines. People have heard of the neti pots, which are also effective, more so for congestion. Usually once you've kind of gone through that and you've tried oral medications such as Singulair and your allergies are still horrible, then that's the next step to go ahead and get allergy tested and start on some allergy injections.
Quickly, I brought it out. I've got a little prop. I've got the over-the-counter nasal spray. Positive, negative when you're using something like this?
So Afrin, good and bad. Afrin is okay for 3 to 5 days. You can use it to relieve severe congestion. Beyond that, what happens is your nose kind of becomes, quote, addicted to it. And unfortunately, it sets up a condition where you have to spray it in order to not have congestion, and then you're doing it every day.
Okay, obviously, my tagline is always, if you have questions about something like this, don't email me, don't call me. I wear the blue coat, she wears the white one for a reason. You always want to talk to your doctor. Doctor, I appreciate the time this morning.
Thank you. Nice.